quickly we're going to see Lambert-Eaton Syndrome. Lambert-Eaton Syndrome is, here we have the alpha motor neuron, here we have the synaptic button, this is the muscle. Here we have the despolarization coming from, so there is opening of the sodium channels. Here, a little bit more close to the synaptic button, we have calcium channels that they will open, and so calcium will enter, and so this calcium entering promotes that the vesicles fuse with the synaptic membrane, and so the release of acetylcholine that goes here to these acetylcholine receptors. So in Lambert-Eaton syndrome, there is an antibody against these calcium presynaptic calcium channels, and so the patient will have myasthenia. This is a reverse myasthenia. We will see why. But so the patient has fatigability of the muscle. Usually has proximal muscle weakness. Also could be of the autonomous nervous system. So the patient will have dry mouth, constipation, etc. There is less involvement of the bulbar and ocular muscles as opposed to myasthenia gravis. And the patient will have hyporeflexia. Usually don't, but if it is severe, it would have hyporeflexia as opposed to myasthenia gravis, in which the reflexes are conserved. This is commonly seen as paraneoplastic syndrome, especially with small cell lung cancer. So in that case, we need to do further workup like a CT scan. But for the Lambert-Eaton, the best initial test would be the PQ type antibodies against these calcium channel blockers. Additionally, now the treatment could be, the best one could be pyridostigmine, that is a acetylcholine esterase inhibitor, so we will increase the acetylcholine here at preventing the breakdown by the acetylcholine esterase enzyme, this one. And we can add that to 3,4-dihydropyridine or guanidine. If it is severe and it is not resolving, we can give corticosteroids or azathioprine. And in severe cases, IV immunoglobulins. So is giving like plasma. So we will give these IV immunoglobulins in order that the immune system attacks to these ones instead of the ones that are coming here, and etc. We will block the degeneration of these calcium channels. Also, we can give something called amifamidine. This is a channel blocker of the potassium channels. That can also work. The important issue here is that as much time as we stimulate the muscle, we will see an increase in the response as opposed to myasthenia gravis.